It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I talked about 5 things the intensive care team hasn't told you when your critically ill loved one is dying. You can check out the last blog by clicking on the link below this video. In this week's blog, I want to talk about, do intensive care units have a one-size-fits-all approach to dying in ICU? Before I get into today's topic, I want to share a quote with you that I wrote on today's topic. And the quote goes like this: when critically ill patients in intensive care approach their end of life, most intensive care units and most intensive care teams have a standard approach to death and dying. They usually say things like, "We've tried everything that we could," or they say things like, "Any further medical treatment is futile," or they say things like, "It's quote-unquote in the best interest for your critically ill loved one to let them die." Whilst everything that I mentioned may well be true, the approach to dying in intensive care still leaves little room to give people choice and actually gives people what they want. Research and surveys have revealed that 75% of the population in first world countries, if given a choice, want to die at home. The reality, however, reveals that less than 15% of the population actually do die at home. Therefore, intensive care services as well as other health services are failing to deliver what the vast majority of people actually want in an end-of-life situation. Most intensive care units all over the world have a standard, one-size-fits-all approach when it comes to end-of-life situations in intensive care. Once critically ill patients in intensive care are approaching their end of life, ICUs follow certain policies and procedures to aid critically ill patients dying. This one-size-fits-all approach leaves little to no room to give critically ill patients and their families what they want, but is rather a reflection of current realities in intensive care. A much better approach to end of life in intensive care is to listen to people and offer them end of life situations on their terms. Follow people's wishes and give them the opportunity to die at home. Thankfully, services like intensive care at home are making this transition possible now, creating win-win situations for all stakeholders. So, let's get into today's topic. I can't tell you how often I've heard families in intensive care saying, "It would be so much nicer to have our loved one die at home instead of in intensive care." When critically ill patients die in intensive care, ICU tends to have a one-size-fits-all standard approach. It means that once a critically ill patient's life can't be saved, the intensive care team uses a standard approach by ceasing treatment and/or life support and using sedatives such as midazolam or worse, and opiates or painkillers such as morphine or fentanyl to aid a critically ill patient going from life to death. That's virtually the one-size-fits-all standard approach offered in intensive care. It goes totally against what more than 75% of the population wants, which is to die at home. Albert Einstein once famously said, "A problem can never be solved by thinking about it at the same level than it was created." Having people die in intensive care, even though patients and their families want to die at home, means that the problem can't be solved on an intensive care level. It needs to be solved on a different level. So what do I mean by that? Well, intensive care is a volatile, dynamic, stressful, political, hierarchical, and non-family friendly environment. Death and dying are usually very private matters that should be managed by families and not by health professionals. Health professionals should be there to aid and facilitate the process of dying in a manner that is dignified and conducive to the wishes of a critically ill patient and their family. And again, those wishes are crystal clear according to research and surveys that more than 75% of the population in first world countries want to die at home, and yet less than 15% of people actually die at home. Therefore, there is a big mismatch in delivering people on what they want during a very important time at the end of people's and their families' lives. You also may want to check out another video that I made about the difference between real and perceived end-of-life situations when your loved one is critically ill in intensive care. And I put this link to this video in the article below this video. Check this out. Coming back to end-of-life situations in intensive care, it's often that all intensive care unit has to offer, or intensive care has to offer, is this one-size-fits-all approach to death in intensive care. That approach is usually a result of failing to listen to people, and it's a result of intensive care teams knowing it all and, quote-unquote, knowing what's best. From my perspective, it's also a result of being ignorant to what's happening in the real world and what people really want. So what do I mean by that exactly, and why should I be the one telling you about this? And look, after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager for over 5 years, I have certainly seen my fair share of people dying in intensive care, and I know that this one-size-fits-all approach in intensive care has failed. I also talk to families in intensive care every day of the week with my one-on-one counseling and consulting service here at intensivecarehotline.com. I therefore have a very good understanding of what people want and what they think. I have also worked with many critically ill patients and their families in a home intensive care environment. Therefore, I looked after patients at home in palliative care situations that otherwise would have been in intensive care, and they've all been on life support, such as ventilation. So therefore, I really have a good understanding of what people want, what they need, and I do have an understanding of what's possible in the real world. I also have intimate knowledge of what goes on in an intensive care unit, and I know exactly what's happening behind the scenes in intensive care. Therefore, this one-size-fits-all approach of intensive care teams when patients are dying has failed on a moral, ethical, cultural, religious, spiritual, and on a clinical level as well. It's also failing on a level that creates win-win situations. So what do I mean by that? A win-win situation is a situation where all parties benefit in a situation. Let's look at the interests of all parties in an end-of-life situation in intensive care. First of all, families in intensive care want to mostly have end-of-life situations on their terms in their own homes. At the end of the day, they want to make informed decisions. They want to have peace of mind, control, power, and influence. Families also want to have a sense of meaning and belonging that they can find in a home care environment and not in an intensive care environment. Intensive care units, on the other hand, want to have access to beds, staff, equipment, and other resources in intensive care. and they want to maximize their revenue. It's as simple as that. A bed in intensive care costs around $5,000 per bed day. Therefore, health funding agencies have an interest in keeping their costs down in such a high-cost environment like intensive care. In order to meet all the needs of the stakeholders when patients are inevitably approaching the end of life in intensive care, one doesn't have to be too creative to come up with a solution that provides everybody with a win. Especially when in some situations patients are dying over many weeks and sometimes many months in intensive care, often on life support such as mechanical ventilation and a tracheostomy. Therefore, a service like intensive care at home is providing a win-win situation for all stakeholders. Because intensive care at home enables critically ill patients and their families to be in an environment of their choosing where they can be in control. It gives them peace of mind, control, power, and influence. It also meets their individual, cultural, religious, spiritual, and family needs in a home care environment, removed from a sterile and depressing intensive care environment. And most of all, it gives families an end-of-life situations on their terms and not on the ICU team's terms. But a service like intensive care at home also gives intensive care units what they want by giving ICUs the ability to discharge their critically ill patients earlier and freeing up their precious, in-demand and expensive intensive care beds. They also can admit other critically ill patients. They can free up other resources such as beds, equipment and staff. And they can maximize their revenue by having a higher throughput of critically ill patients. And last but not least, a service like intensive care at home is giving health funding agencies the ability to save costs by reducing the cost of an intensive care bed to around 50% in a home care environment, and supporting patients, their families and intensive care units by focusing on their needs. And also, it gives families and their critically ill loved ones meaning. Also, intensive care at home is a proven and evidence-based concept, and it's a concept widely accepted since it was introduced in the late 1990s in Europe. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling with me via Skype, over the phone and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.